Proceeding on in our discussion of seasonal influenza, there are several types of antiviral treatment that can be used in trying to combat the infection. The two most common antiviral agents that we have at our disposal include oseltamivir, also called Tamiflu, the trade name, and zanamivir, trade name Relenza. Both of these can be utilized and do appear to have generally some efficacy in impacting the disease, generally by shortening the duration of illness by 24 to 48 hours in general. They can also, it appears they can help prevent complications of influenza additionally. Other influenza viruses are out there. In particular, we need to be aware of various kinds of variant flu, the swine flu, for example. Certainly avian or bird flu is in the news frequently these days. And pandemic influenza, which has been in the headlines as recently as 2009 when the H1N1 strain became a pandemic and caused disease widely across the globe. And of course, we're always on the lookout for new strains that can become pandemic strains as well. The H5N1 strain right now is one of the main avian strains of concern. It is a type A influenza virus carried in a number of different bird populations that migrate across the globe. Human exposure to the virus occurs most often after close contact with poultry in farms and in markets. That is primarily where most of the infection is likely to be transmitted. Occasionally, this infection may cause severe human disease. In 1997 and 2003, in particular in Eastern Asia and Hong Kong, there were a number of cases and deaths that did result from exposure to H5N1 avian influenza. Here's a look at the cumulative number of confirmed human cases for avian flu. Influenza A type H5N1 reported to the World Health Organization over a 13-year period from 2003 to 2016. And I think you can see that the number of cases and deaths as well is quite substantial. 854 total cases, 450 deaths reported during that period of time. The distribution of those cases and deaths are shown on this map. While there was a single case and death in Canada, North America was largely spared, as was South America. Most of the cases occurred in Asia and contiguous parts of Africa, such as Egypt. These cases, again, predominantly resulted from exposure or close contact with poultry. The source of H5N1 is either sick or birds that have died after infection by the virus. The incubation period in humans is usually 2 to 10 days. That is time from exposure to when symptoms first appear. The symptoms themselves are generally high fever and influenza, typical influenza-like symptoms, but may also include diarrhea, nausea, vomiting, abdominal and or chest pain associated with a viral pneumonia. The onset to severe distress in the cases that are more intense and may result in need for hospitalization, for example, tends to be about 4 to 13 days post-exposure. As for all other types of influenza, antibiotics are not effective. There are antivirals, of course, in existence. As we mentioned earlier, oseltamivir and zanamivir can be used. Those are oral or inhalational forms, and then peramivir, which is an intravenous form. All of those may be effective against avian strains. There is a vaccine that's FDA approved that is stockpiled by the government for use in case the virus should become easier to transmit from person to person. Of course, that's the major issue with avian flu, easy to transmit from contact with birds themselves. Fortunately, more difficult, substantially more difficult to transmit from person to person. And if it were to become much easier to transmit through that mechanism, the avian strain could easily become a pandemic strain. So we are looking at ways to prevent transmission, obviously under all circumstances, and the main ways to do that are by avoiding the sources of exposure, avoiding contact when unnecessary with the bird population, and then infection control procedures when individuals might be infected, to include standard plus contact plus airborne precautions. And the virus, of course, is contagious, but we normally see limited human-to-human transmission. And then why might you ask, do we use airborne precautions in that setting when transmission might be quite limited? Well, the issue is that the virus, if contracted, is highly lethal, and that human epidemiology is not terribly well known, such that we may not be able to exclude the possibility of airborne generation of ultrafine droplets in any given case, and therefore it's much more reasonable to utilize the strictest precautions when you're dealing with such a severe and virulent strain of influenza.